with your bachelor's degree, many more avenues start, they start up becoming unfolded in front of you. So let me start. It's not actually a, what do you say, a big PPT where you have to sit down and understand, jot down anything. It's just so that you come to understand what all fields are open up for you. So let me get straight to it. I hope everyone is able to see the PPT.
See.
Okay. So the first thing that pops up, and anybody who has any question, please jot it down in the chat section. I think then I can just take it up in the end of the session. So what is the first thing that comes in your mind as soon as you're done with your degree? It's like when you are passing on from the third year, fourth year, and you're into internship, you're like confused. Okay, this is not what I thought I wanted to do. Or maybe you're not one of those person who wanted to get into the clinical, like hands-on patient related things. Probably you are someone who was like, no, this is definitely not, this stream is definitely not for me. I want to go somewhere where I can sit down and do the managerial part. So what all things open up for you? You will be either confused, do I have to start my own clinic? Do I start my clinic? Do I get into a corporate base of physiotherapy where I will get into it as I go through the slides? Or do I go into academics? Like, do you want to pursue your masters? If you want to go to the master's section, do you want to go into the teaching side? Or do you want to go abroad? I mean, that is the first thing that comes in your mind. Are you someone who doesn't want to practice in India at all? Do you want to go abroad? Are you clear about the fact that, okay, then maybe whatever you have learned, maybe something different you will have to learn when you go abroad, the licensing procedure, that itself is a different thing. Or do you want to work in the hospital? So hospital scenario of a physiotherapist is totally different. You may be completely based in working in the hospital according to your specialty, or maybe you will be tackling a lot of patients that is not your specialty. That could be one of the things. Or you can be completely diverting from physio, not completely, but at least the medical line will change and you will get into management instead. So is it what you're looking for? So, when you will get it aware of that fact, when you're in the fourth year and entering the internship, do you realize you're more inclined towards hands-on, or you may be someone who's more inclined towards seeing yourself as an academician or as a teacher, or you will be more inclined towards handling managerial part. So I'll go step by step. So if you're someone who wants to start your own clinic, these are the few steps that I would advise anyone to follow. So basically, when you're in that junction, what you would like to do, ask yourself, what do you like to do? Are you someone who want to see yourself with patients or no? Okay. So with that, if you say, oh yes, I do want to go ahead with my patient hands-on skills, then maybe I want to start my own clinic. But even starting your own clinic is not something that will be like, okay, today I decided and tomorrow I'm starting my own clinic. No, it requires a lot of planning. Like I can tell you from my experience that I started my own clinic after completing 3 years after coming back from my master's. So I was very well in my head. I was very much sure, okay, if I want to start my own clinic, I want to get a little experience of coming back to India, knowing the physiotherapy scenario in the country that I'm going to stay in, or the city, even a city where you are staying in matters, not just the city, even the place that you are planning to start your clinic matters. I'll tell you why. So, what kind of practice are you imagining yourself in? Are you someone who wants to start your solo practice, or you want to go ahead with your friends? Like, you must be, we used to do that, that you must be in your classroom right now and you was thinking, oh, I have my best friend. I want to start off my clinical practice with her, or maybe start a clinic with her. So, is it something that you are thought? So, what is the advantages and disadvantages of it? So, what happens is when you go for partnership, there must like, there are some advantages for it that you don't have to do all the work yourself. You always have one partner with you who can take over, like you can divide your part. Maybe someone who can take care of the marketing and managemental side, and there will be one partner who's looking after the clinical side. Or there can be two different partners, maybe one who's a neurotherapist, one who's an orthopedic physiotherapist. Then they both can say, okay, this is how we will balance it out. But then what happens when you're into partnership physiotherapy clinic is like you lose your control, like you will have to divide your profits. You have to take into consideration even the next partner who are you working with. So, sometimes you have the danger of mixing business and friendship. Okay, sometimes you are not serious about some things at times, but that can happen. So maybe before you get into a partnership based clinical physiotherapy clinic, you have to take that into consideration. What are the advantages of running a solo practice? The benefits are all yours. The business tactics, the marketing strategies, all yours. But then it falls on one person that everything will be done by one person. Everything handled by one person. So you should be really sure what you want to get into yourself. Next thing, okay, what do you want your physical therapy? Like we don't have insurance based currently, but there are a lot of physical therapy clinics who have tie-ups with a lot of companies. Like, maybe some private company likes your practice and they tie up with you. So they have a lot of like, 50-50 share basis. Are you okay with that? Or if your cash based system, how do you want to understand what cost you will incur, or what are the charges you want to give to the patients? That all comes into financial planning. Next that we come upon is, this is very very important. What location are you planning to start in a community that is already saturated with a lot of clinics, or do you want to start your clinical practice in a place which is not yet untouched? What crowd stays in that area? Are you looking for crowd that is a lot of like business, is it a business area or is it a residential area? So all this question, what type of reimbursement? Because of according to the area, your charges will also differ. I think a lot of people will agree that if you're in a certain part of the city, the charges of a therapist are slightly different to if you're in from a different part. So you need to consider that also. That if you're from living in some other part of the city, are you okay with starting your clinic in that area, or you want to move to an area that will give you benefits because of that area? So that is your, since we are a physical therapy clinic, does your place of clinic has a lift? Does it have an accessible area? Do you are you able to make sure your patients can come in easily, or is it going to be a hurdle? Like just imagine you're going to start your clinic on a fourth floor without lift. Are you think you're going to be able to get as many patients who are already suffering from so many aches and pains coming down on the fourth floor? So these all things are very basic that you need to think of when you start your own clinic. Then what specialty should I choose? Means once who have done masters, they will be definite. Okay, I have done my MSK masters. I want to start my MSK clinic. But then there will be some physios who will be thinking, okay, if I am an MSK practitioner, I want to tie up with someone who's a neuro. Or if, or what do you say? If you are someone who are okay to refer, maybe you can tie up with someone from outside, maybe a neurotherapist, cardiorespiratory therapist, a geriatric therapist who's ready to, share the patient load with you. And specialty, I'm seeing a lot of therapists who are going into the niche specialties as well. If you know, then a lot of therapists who are coming up with just female related issues, pelvic floor exercises and all that. Those are very niche practices that are also started to come up in our city. So you can even think about that. Then equipments, like when you start off your clinic, even I was in this dilemma. Okay, do I want to purchase a lot of equipments? Because when you're starting your clinic, you already have spent a lot on the rental and everything on that aspect, but now you have to even think, those equipments that I'll be using, do they have to be very high end? Would they have to empty my pocket, something like that? But when I started my clinic, I made it sure that I don't want any bulky equipments for the start. I would like to invest in something very small, like maybe TheraBands, weight cups. And my funda is that if I know, if I use this equipments, the patient will be much able to use those equipments at home. Maybe if I tell them, okay, these are the TheraBand exercises that you want to patient to do, you can tell the patient, okay, you may have to buy that TheraBand and do it at home. So that way it will be a transition of the practice that they are doing with you that will go back to their home. So maybe think on that line, like what equipments you would want to buy and that are very essential. Maybe if you're planning to buy a combo machine which is a little expensive, you can go for a very simple ultrasound machine or IFK machine separately that will not drain out your pockets. Think on that aspect as well. Okay. So free marketing. So marketing when you're starting your own practice plays a very very huge role. So since we are more into like throughout the college time we are just into our practice, like okay, I want to just see the patient, this that. But are you aware how you're gonna get those patients? So the first thing first is you need to start communicating. Communicate with a lot of people around you. You know, your first communicating people are your family and friends. Tell them, okay, not the physio friends, like even your other friends, right? Okay, I'm practicing this. I'm going to start my own clinic. Spread out the word, in your community. Nowadays, social media is such a boon that you can just keep on advertising your stuff, before you start off your own clinic as well. That okay, what are you practicing? What are you planning to do? And the first practice, okay, I know you have to tie up with a lot of consultants in your area, may it be physicians or even orthopedics, but even the referrals coming in from your old patients, they also play a huge part. I haven't, like, there are many nowadays, there are many companies that you can hire to do your marketing. But frankly, in my practice for so many years, I had never got, I never had the need to hire anyone because the first people who would refer you are your own patients that you have treated. When they see what all stuff you're doing, or they have got some relief, they will say, "Ki, okay, oh, you have this issue, why don't you go that? Oh, you have a back issue, oh, why don't you go to the therapist I saw?" So that is, they are the first ones to be a good referral system. Next can be your doctors and everyone you need to go and speak out to. Check out the doctors in your area who are going to refer to you, maybe physicians, including all the doctors in your area. You can just drop by, take the 5 minutes, take an appointment, take a 5 minutes appointment, and tell them, "Okay, I'm in this area. I'm going to start off my own clinic. These are the things that I plan to do in my clinic. You can have a stopover, like you can go one day and see my clinic. That you can do. That way, you can just build up your marketing branches. That is one of the things we need to really focus on. So this is all about the clinic part that I wanted to say. As I said, there are very much, like, few bullet points I would like to talk about is communicate with everyone, get out. I know, like, you can actually start making pamphlets or something like that. Do it, get it done. Facebook, Instagram, Twitter, a lot of the social media is going to help you. Second thing is, of course, you have to consider what type of clinic you want, what specialty you want to make it. Third is, really you need to get started on as quickly as possible, or maybe before you start a clinic, it's good that when you get out of the college line, wait for at least a year, understand how the system is working, understand what practice is right now in vogue, what specialty you want to choose that way. All right. The next thing that I did was hospital management. So basically, I'll tell you my story. I went for my master's, and then I came back to India in a month after, after completing my master's over there. So here I came back and I realized, when you're working in the hospital, okay, I'm okay with doing the clinical part, but now I have something fascination towards management, going into the meetings, being a very valuable point, where I want to take decisions for the hospital as well. That's when I realized, okay, my clinical degree won't be helpful in that part. So then I started doing my management from Symbiosis International University, which gave you a course which is dual course, that was like hospital management and medical legal systems. So how did it become an advantageous part is, like, the hospital was looking after for someone who would fill up their shoes for quality manager. So I went into that not knowing exactly what it is, and I'd already completed hospital management. So hospital management and quality were like, okay, it has some, what do you say, some linking in between. But after completing hospital management and getting into the quality management part, I was like, I want to do specialization. So I even did certified Green Belt Six Sigma, which gives you a outlook of what quality management is. But hospital management by itself gives you a lot of scope into getting into, you know, um, quality manager, or maybe patient care manager, something like that. Anything, if you want to become a manager in your hospital, you do need a backup of a managerial degree. So either some students who are very much sure that they want to live physiotherapy and go into MBA, they can do that. There are many colleges who are right now offering roles. For example, I think Billingker is giving, this is giving, but that is when you have to go directly into an MBA. But what I did a diploma. So I was sure I don't want to live my physiotherapy background as well. So when I did the diploma, I was fortunate enough to be taken into the hospital in the quality management section. So that's when both of the things started coming out. So now, if you ask me what is quality management is basically looking after all the things that happen in your hospital in different departments. You're not just restricted to your department. You have to make sure even the painting in the hospital is correct. to the fact that the biomedical disposal is the way it has to go through the system is correct. Okay, all this is help the background of hospital management, and being a clinician myself helped me through. So what do you do in management? You will be helping in the planning and budgeting of your hospital, management of outsourced business services, management and introduction of technological updates like the use of new software for record management, effective communication of new policies, patient programs, and benefit planning. So when into you get into that, you're not just a physio. You have to think about everything. When you're in management, you're taught how to do the financial managing, budgeting, including if you're doing Six Sigma. They even show if you're trying to get any system into your hospital, you have to run a project to make sure that system is helpful. For example, I can say that if a certain new policy has to be implemented, before the implementation, you have to run it for 6 months in the hospital. You have to see if it's benefiting you. Maybe something simple as you want to start a kiosk for patients in your hospital. You first need to see how advantageous it is. You have to run it for 6 months and then realize, okay, if it's good for you, that's what I want to go ahead with. So these all come under like management. And as you grow ahead in your positions, you can see yourself becoming the manager and assistant manager. You can reach like sky is the limit, and not just into hospital management. If you're into quality management, you different avenues open up for us. Like I have seen some quality personals who do NABH training, and those are the people who can come and see what is the quality, what is say NABH guidelines that the hospitals are like following. So that is different course in itself. Actually speaking, management, hospital management has so many vast avenues that it's not just one that you will be stuck in the hospital. In fact, you can go to different sections, not just hospitals. You can go in pharma companies, etc., etc. Then corporates, as I mentioned before, how a physiotherapist can go into corporate. So lot of companies now, big companies like Kotak Mahindra or maybe Nike, they are taking in physios for their big offices. They come and they have a 1 day physio. Like I was going in one company like that. So in a week they give 1 day for a physio, so the employees do not have to go out and seek treatment from others. The employees during their working hours can go and visit the physio in their company. So for that, as I said before, you need a lot of communication. Put up your CVs into different companies. They hire a lot of physios, like certain days that just assigned for a physician, for a doctor, orthopedic doctor, and 1 day for physio. That way you can get into the corporate line where you're just assisting in those specific people in that company. So that itself has come up very nicely. Next says, I talked about what are the skills that will make you a good physio. So once you've just done your masters or bachelors, that is not the end. You want to build up your CV. So how do you do that? So good practical skills, of course, you will be working in your hospital. I think Somaya gives you such a good backup, like it gives you such a good hands-on. So what do you do later? Do you do a lot of workshops? Okay, yeah, you can do it, but make sure whatever workshops you're doing right now are going to help you in the long run. I have seen, I don't want to take out names, but I've seen a lot of workshops that are coming up that are not even accredited. They're saying, okay, today you will learn a specific joint taping and something like that. But I don't know how much it will help you in practicality. Unless you do such courses, maybe taping or maybe mobilization, actually hands on, to realize, okay, that's what you can take it off and use it in your practice. So just going behind webinars and everything is not going to help you. You need to do proper hands-on courses to actually build up your CV and your practical skills. Not just that, make sure whatever webinars or the hands-on courses that you're doing are certified, because half of the courses that you're doing, and if you're planning to go abroad, uh, sorry, I got a question. Aram, I'll just answer it in the end. So, a lot of workshops that you're using, right, they may not be beneficial for you in the long run if you're planning to go abroad. They are not accredited. So, think about that part itself, because the courses nowadays are not very cheap. They start from 7,000 to 12,000 to 30,000. So, make sure wherever you're spending your money is going to help you, your practical skills, and they are very authentic. That is one thing you have to make sure. So just as a good physio and a good manager, you need to have the ability to solve problems. Problems can be anywhere related to your work or anything regarding your skills that you're practicing. Anything that you want to do, just have this problem solving attitude in yourself. Effective decision making skills that actually comes on as you keep on doing, and into when you're going in your practice, you will be handling so many patients. You will get that, but I want you to brush up your those skills. Leadership and management skills, yes, you need to make sure you can lead your team and you can do the management part very well, be it you're a good physio or you're a good manager. Communication skills, I cannot stop harping. Yeah, like good communication, I think we get to learn it through your practice itself. Half of the patient that we get, we just speak well and the patient by himself starts feeling better. So I always feel the way you communicate with your doctors, the way you communicate with your patients, the way you communicate with everyone around you, it puts such a good impact that you will obviously get good benefits with that. Because we need good communication even for the bedside manner, because we will be tackling patients. So if you're good in your way you speak, obviously the patient will keep on coming back to you. Just imagine if some physiotherapist is not good in the way they speak, the patient will never see you again. If you're good, or if you're very bad to your consultants or something higher up in their positions, be it your manager, they will not look up to you. But if you're very grounded and if you're a good someone who can speak well, they will obviously look back at you. Drive to continue learning throughout your career. I always say it is not necessary to just keep on piling up with workshops. You can just go back to BD Chaurasia, open up, start, keep learning, because there are times when you're into the practical world, you forget about the past. So it's good, sometimes you just keep opening up your books, just read through it, always keep yourself updated what is happening new. There are so many things, to be honest, that I learned when I was in bachelor's, but now the new researchers are saying, oh, but it's not going to be beneficial even more. So if you're just going to learn, okay, this is what was taught to me, that's what I'm going to do, that's not going to help you. Keep Our field is such that it bringing up something new every single day. Keep yourself updated, because that's what nowadays patients are asking. They will go up on Google and they will find out. Oh, I had a patient who came for taping and he said, oh, I want something that football player had put on his knee. So they are becoming so aware of a lot of things that are available in the market, and they will come and ask you. So even the patients know what they're asking for nowadays. So your analytical ability and time management. So my schedule used to be very crazy. I used to morning may start up with my physiotherapy OPD. Then I used to do in the afternoon the managerial meetings. All my meetings and my schedule used to be packed with the managerial work in the afternoon. Then I used to even go for visits. And in the evening, I used to go on with my clinics. So time management is nothing. It's very important, in fact, for you to know. If you want to do so many things together, I have to be on time. Your patients will respect you if you treat them on time. Your managers, higher managements will be happy with you if you're on time with the meetings or everything. So basically time management is something we all need to be aware of. So I think that is what I wanted to say from my side. This was just a PPT. I mean, I didn't have to also show you. This was just what I have done, and I can give you a couple of suggestions if you have any questions. Okay, if you're planning to look out for a start a clinic, or maybe if you're not into this and you want to go into management, then I can help you then. So I think you can start with your questions, and then I can answer you accordingly. Sally, is it okay to start with the questions now?
Yeah. I think we can start with Aram's question.
Okay. So Arham's question is, I have told orthopedic surgeons in my area about my clinic, but they haven't shown any interest in sending patients. What can I do to get their referral? So first of all, as I said, have you started like, can they unmute themselves for Siley? Or is it that they
Yeah,
have
we
to just,
can, we can.
okay, Arham, can you just unmute yourself and ask me so that I can help you a bit better to understand exactly
Yes,
what is the
I
question?
did it. Yes.
Yeah. Hi, Arham. So you can ask me.
Yes. So I have been to their clinics. I have given them my card and everything, and I have told them that it's in the vicinity only. But then they don't send any patient. They forget about it.
Okay. So how long has your clinic been in that area?
It's been a year.
Okay. Honestly speaking, it's still new. They haven't seen, a patient who has come back. See, it's not going to be like suddenly one patient coming in and, they will start giving the patient. It's not like that. You have to actually start showing your results. maybe they will not send it in the first go. Like even whenever I went, they didn't send you, okay, I know this, because they don't know you as a person, or they don't know you as a clinician. So what you can do is right now focus on your other patients. Okay, you have marketed yourself to those orthopedics and everything. Focus yourself on the other patients you are getting. Maybe one of those will go back, and one of them, there are so many patients who don't even know that the clinic is in that vicinity. So when you start treating those patients, they themselves will go back and go to the doctor maybe and say, "Arey, you know what? You had told me physiotherapy. I went to that clinic that is just around the corner, and that has given me a good result." So maybe one of the patients will go back to that orthopedicians to say that, okay, I got good results. Basically, and your clinic is just 1 year old, so wait at least for 2 to 3 years for it to set up. Don't worry about the fact that they are not sending. Try to tackle your patients you are getting from just by word of mouth, or you can even have you then on Practo and everything.
Yes, I have done on Google. I have done.
Yeah, go for Practo. Practo is also a very good base right now who can tell you which doctor, they can actually see your qualification, and even the patient will come to know, okay, you have done all this, and all these reviews and all that you get, they will come down.
Okay.
On having such occasions, maybe after 6 months or something, maybe just go back to them again. You can keep having a word with them. Maybe you can invite them to your clinic also one day. Sir, why don't you come and see my clinic? What all things I am giving in my clinic? You can keep on marketing that way. It's not going to be one day thing, like आज मैंने बात किया तो suddenly that doctor is going to send me. It takes a lot of time to get that rapport. It's not going to happen overnight, and don't you worry about it. It will happen one day. So let them know you. That's what I'm trying to tell you. Just
Mhm.
don't stop doing it. They will send. Don't worry.
So if we go for the second time, should we tell the same thing we told the first time, or something else is to be said?
You can keep on telling the same thing. It doesn't have to be like I do MSK, I do this, da da da. You can just tell, ki, sir, how has been the result? Like I have been, telling you about this thing. I have right now seen so many patients. These are the feedbacks from my patient. You can show them the feedback that your current patients who are coming to you are giving. So you can take that into consideration. You can tell them the results that you have got. Just keep a track of your feedbacks as well, so that doctor comes to know,
Okay.
oh, you have done it. Once or twice, you can keep communicating with the doctors. Sometimes the patient doesn't come to you because he has been referred from a certain doctor. What I do is I call back that doctor and ask, oh, hello, yeah, I'm Dr. Nupur and I'm in this clinic, and your patient has come to me. So this is what I'm planning to do. Anything from your side I want you want me to tell me. So that doctor also will come to know, oh, okay, there is someone named as Nupur who's working in this clinic. So keep
Mhm.
communication alive between you both that way.
Okay. Okay. Thank you.
You're welcome, Aram. So I have a question again. I would like to know, can a prospective patient get from your clinic, and how effective is remote treatment? Oh, so right now remote treatment has shown, like all of you, I'm sure, must be getting aware of tele-rehab. I think everyone is aware that currently the situation is such that lot of therapists are not able to go to the treat the patient in their clinics. But now the situation has been a little okay. But tele-rehab is something that has become a really a nice thing right now. Obviously, when you are treating a patient on tele-rehab, it has a good scope, but you will not be able to do complete hands-on what you are doing in the clinic or the hospital. So it is something that you need to learn, not just like go on the screen and understand, okay, this patient has back pain or something. I think now even something needs to be taught how to do tele-rehab. There are a lot of webinars that are coming in that tell you how to do tele-rehab, how to assess the, do the patient, just how to evaluate the patient on screen. But tele-rehab is showing a good promise. You can try that. Obviously, new patients that you're getting, you can have certain screening questions for that patient. You cannot do all the special tests or something. Make a list of screening tests that you definitely want for a patient who's coming to you for back pain, neck pain, shoulder pain. And that way you can formulate an exercise program, knowing the some screening questions, getting to know history. When you're doing tele-rehab, the history of the patient forms a very much base for the treatment. So get to know the history of the patient very well. Try to show them on the screen, communication during the like video call. Okay, these are the exercise I want you to do. maybe even show the people who are around them. Maybe if it's a neuro patient or something, you want even the caretaker with the patient to learn something, so that way it will be more effective. So definitely tele-rehab is something new and it is coming up. I would say that, try to learn, or maybe if you can learn through your seniors who are doing it, that would be something good. Or maybe you can try it yourself if you're very much confident about your skills as well. How beneficial was the master's program you attended in UK, and in what way did it serve as an advantage after running back home as opposed to pursuing master's elsewhere or in India? Actually speaking, I won't just say that, okay, if you go and do your master's abroad, it's going to be like a big stamp on you, and then you can, it's going to make like a big difference. Obviously, your clinical, whatever I learned, clinical based in UK was different to what I learned in India. Okay, they are more focused upon the what do you say, the research value of certain technique. Like even before you're using a certain technique, they go back and say what is the research saying and everything. They're more on whatever good is happening in the research, and they will try to correlate it. That is one thing I learned. But even if you are doing your masters in India, nothing like it, it is equally good. Or I'll say that you get, if you're planning to stay in India yourself, then when you're done your masters in India, you get to learn the patient handling skills more better, since you will be spending 2 more years in India and understanding that. How did it help me as I came back in UK? It helped me in a way that my analytical skills had improved. My way to treat a certain patient, the way approach had changed. So that much I can say. The skill development and the skill courses that I did in UK were different compared to in India. So that's how it definitely helped me when I came back here. So, but there is no harm. There is no one who says that, okay, if you have done your masters abroad, you're going to be any more good than anyone who has done in India. It is almost like, you both have done masters. It doesn't matter. You're good. If you know what you're doing, if your skills are good, you will be good even if you're done it here. Okay. Nishita is asking, man, what about cut practices? Like physios have to give some percentage of your fees to the doctor who have referred their patients. See, now this is something personal. To be honest, I'll give you my personal opinion. I, in my practice till now, haven't had a day where I had to do any cut system practice with any of the doctors. But if it is something on your personal idea. Like, there are doctors who are asking for it. And if you really want at the starting stage to have that, that you want the patients to come in as well. So it is okay. There are doctors who are doing it. But again, I say my personal idea. Do you want to do that? As I was very much sure I didn't want to do it. I was sure that if there was something of that opportunity coming in, I didn't go for it. But if you want to go ahead with it, go ahead. Although I'm not sure if it's what do you say, a lot of doctors aren't doing it anymore, but if they are, then it's absolutely your personal choice if you want to do that. Okay, anymore, it is beneficial to hire a PR person when when you start off with the clinic. So PR person, in the sense, you can do that. There are a lot of right now companies who do your, on Facebook, they do the PR facilities. They make your animated stories and all that. In the beginning, if you're low on budget, I would suggest don't do that. I personally just went ahead with the Facebook page of my clinic, and I went with the website designing. So that's all I did. I don't think so it harmed me anyway, because I was on strict budget. So I didn't go. I never went ahead with a PR person. But if you want to go ahead with it, fair and good. If you know you want to spend a little bit on marketing, why not? When you start a clinic, be sure you want to spend a certain amount in marketing, certain amount in buying the machines, something like that. So if you're sure you want to allocate certain budget for marketing, which is a little more, obviously you can hire a PR person, and it is beneficial because you are not, if you're not into, like, creative person who can, do stuff for yourself, or maybe, make those pamphlets or anything, they become very useful, and they keep on posting your videos and your ideas on Facebook like that. If you want, you can definitely hire. That's what I feel. But again, if you are tight on budget, it's fine, you can do it by yourself. That's fine. Can you give us some brief information about the teaching professions in physio? So I think for more than that, I would ask the teachers to do it who have completed their masters and going ahead and teaching right now. But again, I think if you want to start teaching in India, you have to do your masters. That is, I think, the first and foremost thing. And if you're more into academics, you can again go ahead with your PhD. And teaching at itself, it should be something that you like doing. Not everyone can be good teachers. That's what I feel. If you think you're a good teacher, complete your masters, get into your colleges. Like, there are so many advertisements that comes, that there are vacancies for assistant professors. Go ahead with that. But the first thing when you're starting up with teaching, you need to be sure that this is something you want to do, because as I said, teaching is not a child's play. You need to handle a lot of stuff. Okay. How long until physios become the first line treatment practitioners and not tertiary for all aches and pains? Uh, that's a very interesting question. It is up to you. I always say that, just one, can I just unshare first? Yeah. So my idea will be like, it is upon us. I know a lot of physios who right now are facing a point that, they have to do whatever the consultant has asked them to do, or they are doing something just because that's what they were doing. But the new generation, that is us and you, we have to make it a point that now that we are coming into this field, we become the first point, like, first point for any patient to approach us. You need to have good communication. That's what I'm trying to tell you. Once you treat a patient, they have so much faith in you that they feel, oh no, I think I would like to go to the physio first. And sometimes I have seen it is not all consultants who do, like, they have become like, no, no, you have to follow whatever I have done. If you really have good connection with those consultants, and those consultants know your treatment, they know you, they will let the treatment be as far as whatever you want to do. At least in my practice, initially when I was starting up, I had a lot of consultants who were telling me, okay, do this, do that. But my funda was, why don't I call them and discuss the case of a physio, like a patient with them? I say that, okay, sir, whatever you have advised, I don't think it will do good for the patient. Maybe my recommendation is such that, why don't we do this? And the what do you say, the consultants are very much open to it nowadays. They are ready to talk with the physios, but then there are exceptions in every field. It's not everyone who is okay with it. Maybe the consultants you're talking with may have had a bad experience with one of the physiotherapists. So that way, we need to have a good communication. So at this stage, maybe when you're into the field for a very long time, the consultants will stop giving you instructions, and when you yourself are doing so well, right, the patients will start coming to you by themselves. I have had patient in my 5 year practice who was like, they start trusting you. They will call you for everything probably. They will be like, oh, I have got this. Do you think I need to see a doctor, or do you think that you can help me through it? It's all about how you progress in your field. Plus, you need to communicate with the doctors. They also come to know your, what do you say, your hands-on and your skills. They will stop, dictating their terms on you. But this is something that is in every country. These ego issues, you can say, okay, maybe they feel, no, the therapist should do that. Agreed. But if you talk to them, you tell them whatever your skills are, whatever good you have done, they will stop dictating. Trust me on that. Like, it will happen. The change is happening. But I want all the therapists who are listening to me right now, take a step, talk to them. Don't just do something because you have been told to do it. Talk to them. That's all I can tell you right now. Okay. Dhwani has asked, can a management course be done side by side with working after internship? Absolutely. Means that is what I was doing. I did like a postgraduate diploma. So when I was doing, I was in fact studying, and even in internship you can do. But I think there are few courses who do not allow that, because the management course I did, it needed me to do a project on the patients or maybe any system. So for doing management, you need to be attached to a hospital, because they have project that you need to do it with the hospital. Or maybe if you have good connections, you can do the master side by side. And maybe for the project module like they have, then you can tie up with the hospital maybe for a 2 months, or maybe whenever you're conducting that project, you can go back and talk to the hospital saying, I'm learning this, this, this. I want to conduct a certain project. And even the college that you're doing your master's from, they will give you a letter saying we have allowed the student to perform certain this what do you say, this project, kindly allow them. So you can do that. You can do side by side, nothing doing. As I said, if you're good with time management, you're able to take out time for studying. It is not something easy. Trust me, you have to go back to everything from finance, budgeting, quality management, everything comes under that. So it is not easy. But if you are able to do it together, why not go ahead with it? It's a very good thing, because when you'll be passing out, there will be two different modes to you. You may feel okay, I like this management part. Maybe I will go full fledged in that. Maybe you can do that as well. Can management course be? Yeah, that's done. What is the scope? How good is the scope is post physiotherapy? How any good university you're not gonna? Okay, to be honest, I won't know the particular university since I have not gone there myself, the New Zealand and same. But sports physiotherapy is something really catching up in India. We have a lot of league, IPL, or maybe the kabaddi matches that are happening. Those are really catching hold of a lot of physiotherapists, that they need physiotherapists to work with their teams. So rather than doing just musculoskeletal, sports physiotherapy has also come up as a very good branch in our stream. So yes, students who are interested in that can definitely go and pursue that. Could you tell us what could be the next for physios to treat it post-COVID? How important is it for patients to visit physio? Okay, so basically, after I think this is something that everyone must be thinking, even as physio, even I am thinking, post COVID is going to be a little difficult for us. Honestly, even the patients will be a little scared to come back because it's a little hands on what we do. So first of all, we need to be sure, like, okay, this is what all the precautionary levels I want to start with patients. Maybe I should start wearing a good what do you say, do the good hand hygiene and everything like that. If you can propagate your clinic in a way and show them that you're following certain steps in your clinic, or maybe wherever you're working, the patients will start coming. It's not going to be long before they also realize that we cannot stay away from physio for a very long time. But it will take some time. But don't worry, till then you can concentrate on tele rehab. You can even concentrate a little bit on how you can increase your skills by that. Maybe when you're sitting home, you want to increase your skill set. Maybe go listen to some webinars, go back to the things that you have learned. Just keep on grinding your skills. That's it. Like, just keep on refining your skills during this part. And I think I have answered all the questions that I got over here.
Yeah. Nupur, I would like to ask for hospital management, is there
Mhm.
any different entrance exam? Like, how do the students go about it?
Okay, so basically, thing is, if you're going hardcore MBA, you will have to go and do the CET for that, which is for MBA part. But if you're not planning to do MBA, then there is something called as diploma. For that, you do not need any entrance exam. Like with the one which I did from Symbiosis was a distance a hospital management course and medical legal systems. That did not require any CET. You can directly do it after you're done with your bachelor's, or you're going into what do you say, if you're doing your professional, people who are even practicing right now, even they can do it. As I said, you only need to tie up with a hospital or some place when you're doing the project base. Otherwise, you can do it right now also. Like, there is no age cap or something in that. You can do it anytime you want.
Okay. And what's the duration of it then?
Okay, so
For
the
the
one with
diploma and for.
diploma is a 1 year course, but then again, a lot of colleges are offering it. So you need to, the one which was offered by Symbiosis International University was a 1 year course. But there are different colleges who offer different courses. So what I would suggest is go online, check out all the colleges. There is Indira Gandhi University who's doing that. Then you have Symbiosis which is doing that. So if you are sure you don't want to do a proper MBA, which I said MBA has been offered by TIS, you have Wellington Institute who is doing that. If you're very much sure you want to get into management, I would suggest ki go abroad if you want. Even they have really good courses into management. You can do that as well. But if you're someone who are not who's just want to taste management, then I will say get a diploma. And if you're really like fortunate, and if you're working in a hospital that has like vacancies for managerial roles, then you can pitch yourself in that, okay, I have done this, and I would like to get into managerial roles. So they will offer you something small, like even patient care manager, that you have to go and actually just interview patients every day in the hospital, asking, oh, how are you? What are you doing? What are the things that you are expecting from the hospital? Then there are roles that are like, in the OPD manager, as an OPD manager, you can start working in. You can go into, as I said, even into administration part, like maybe admining the non-clinical roles, maybe like handling the PCA part, or maybe handling admin part, which is not totally clinical as well. That also you can do. There are a lot of avenues actually if you go into hospital admin.
Thank you.
Anyone? Welcome. Any more questions that you have that you're confused between? Anything you want to do?
Nupur, hi.
Hi, who's that?
Hello.
I'm not.
Hi. I'm
Hi,
Shweta.
ma'am.
Hi. It was a good session. I enjoyed the session so much so
Thank
that
you.
you pointed out such small things as in quality management as painting on the wall. Like you take care of such small things you said, and
Yes.
communication which you specified, which is so important, so important. And
Yes.
overall, what I could see is you are as open, as confident, what you always were, and now you're more rooted in your personality, and you just know what you're doing. You're a self-made person. I
Thank you so
enjoyed
much,
the
ma'am.
session.
Thank you so
I
much,
enjoyed.
ma'am. It was
Thank you. Thank you.
learned from you, ma'am. Thank you so much.
No, no, my pleasure.
Fine. And even that's Sally, is it okay now?
Hello, Nupur.
I think
Am I speaking?
Yeah, hi, Sally.
it's Anna ma'am, Nupur. Anna ma'am wants to talk to you.
Oh, okay, great.
How are you?
Hi, ma'am. I'm doing great. Thank you. How are you?
I'm fine. How is the clinic and everything doing?
Everything going fine, ma'am. All as I'm telling, I'm doing tele rehab more now currently. The
Yeah,
new thing.
all of us are doing the same because we are
Yes,
at
ma'am.
home and the patients are out there in their homes. But it's a
Actually, ma'am. I
wonderful
think.
way.
Mhm.
It's a wonderful way of treating patients because they understand and they are able to get relief also. So
Absolutely, ma'am.
till the time that they can come to us or we can go to them, that's the only way forward, I think.
Yes, absolutely, ma'am. I think that is something new that, I mean, it was existing, but just that, because of COVID, suddenly it has become a new thing. And I think nowadays, even the students should start learning all this. I think it should be the new chapter in whatever we teach, tele rehab, I guess.
Maybe it will come soon. And only thing is
Absolutely,
that it has certain legalities that need to be taken care of because nobody should get hurt or anything. So that needs a little bit of understanding. So maybe
absolutely,
we
ma'am.
need to make a consent form and get them to get the consent from them so that you can go ahead without any legal problems.
Yes, I think that is one of the important moments, point which ma'am has come up with. Take a consent because it is something the patient is not coming to you in person. So maybe legality will be an issue. So take consents. Yes, ma'am. That is one point, important point.
And I just wanted to tell Arham if he is still there, you wait. I'm sure you will be able to work it out with all the doctors who are there and they will start sending patients to you. Like Nupur said, keep pursuing them. Tell them the good things that you're doing and how your patients are improving. And surely they'll decide one day, okay, they need to try you also to see whether they can get better improvement.
Absolutely, ma'am. And what has happened, the physios which are already existing in that zone, the consultant generally prefer sending it to them. So it will take
Right.
some time. Like I took like at least 2 years to break into that circle. Okay, I am there. I'm existent. So it will take some
Yeah,
time.
right.
Don't get discouraged.
That's it. Correct. Absolutely.
Thank you,
Thank you.
ma'am.
It was a really
Thank you
informative
so
session. I'm
much,
sure
ma'am.
all the students must have got some idea of what they need to do before they start something.
Yes, ma'am. Thank you.
Bye then.
Bye bye, ma'am. Thank you.
I think there are no more questions.
Yes. Thank you so much, Saili, for inviting me, and Isha ma'am for taking this okay, taking
Eh,
this session ahead. Thank you so much. And I will be available for all the students. Like if you want, you can just share them my number. So in like I lot of time I get those questions like in personal, like they would like to ask me like, okay, ma'am, something like this I'm thinking. So you can share my number, no problem at all. You can talk to me. I will be all time ready to hear your questions and help you out whatever way I can. And thank you so much. Thank you so much for coming.
Thank you from the entire college, and I would like to thank all the teachers and thank you to Veena ma'am. She has joined the session today. And thank you all the participants who were very enthusiastic and they asked so many questions. And I think your session was also very good in which you covered each and every point.
Thank you so much. Thank you.
Yeah. Thank you.